Okay, so our study is called the Efficacy Study of a Social, Communication, and Self-Regulation Intervention for School-Aged Children with Autism Spectrum Disorder, a randomized controlled trial. So first, some background information about the study. Individuals with autism spectrum disorder often struggle with social communication and self-regulation. Previous studies demonstrate that deficits in social communication negatively impacts academic performance, is associated with anxiety, depression, and affect friendship and employment opportunities in adulthood. Self-regulation deficits, including emotion regulation and executive functioning difficulties, also negatively impact engagement in academic and social settings and correspond with reports of lower quality of life compared to non-ASD peers. So now we have the purpose, and the aim of the study was basically to examine the initial effectiveness of a parent-assisted community intervention for school-aged children with ASD that targets both self-regulation and social communication skills. So this is where the Growing, Learning, and Living with Autism group comes in. The purpose of the Growing, Learning, and Living with Autism group, also known as the Gorilla Group, is to provide children diagnosed with ASD and their parents with self-regulation and social communication skills that can be incorporated into their day-to-day routines. So this intervention combines components of structured teaching and social thinking, which was designed to increase the social communication and the self-regulation in first and second graders diagnosed with ASD. So some research questions for this study were, the first one is the Gorilla Group intervention efficacious in teaching self-regulation and social communication concept knowledge to first and second graders with ASD and their parents? And do first and second graders with ASD or their parents who participate in the Gorilla Group intervention gain more self-regulation and social communication concept knowledge during the 12-week intervention period compared to a delayed control group? Do gains in concept knowledge by parents or children associated with the Gorilla Group generalize to parent interactions after completing the group? Is the Gorilla Group a socially valid intervention for teaching self-regulation and social communication strategies to first and second graders with ASD and their parents? Are gains in child and parent self-regulation and social communication concept knowledge maintained 3 and 6 months post-intervention? So these are some of the questions that researchers would like to answer throughout this study. So moving on to methods. Participants were 17 children diagnosed with ASD and their parents. To be included in this study, the children had to meet certain criteria. So first, they had to have a medical diagnosis of ASD documented from the University of North Carolina Teach Autism Program or another clinic based on the DSM-5 criteria, supported by an autism diagnostic observation schedule and clinical parent interview. They had to be included in 80 to 100% of the time in a first or second grade general education classroom. They had to read on a first grade level or above based on parent report or an IEP. And they had to be able to tolerate separation from their parents for up to 30 minutes. To be continued with methods, although all children had a documented diagnosis of ASD, only 5 in the sample met the AAC cutoff score of greater than or equal to 15 on the Social Communication Questionnaire, or the SCQ, at the pre-intervention assessment. So validation studies of the SCQ found that this cut point is less valid for use with children under the age of 7.5 years than for older individuals, and that the SCQ is more sensitive to children with lower cognitive and adaptive skills than high-functioning children. Since the SCQ is technically a screening tool and not meant for diagnostic purposes, the child's original diagnosis using the Autism Diagnostic Observation Scale was considered more valid than the SCQ, and therefore the children who did not meet the SCQ criteria were still included in this study. So, moving on, the groups were split into 2. The first one was the intervention gorilla group, which consisted of 8 children, and the second was the delayed treatment group. It was stated that one of the families moved, leaving them with 17 participants. So as you can see on this figure right here, this was included in the study to show why they're saying there was 8 and 10, when in the beginning of the study it stated there were 17 children involved. So as you can see, after randomization, a family moved away, leaving 17 children. So which made it 9 in the control group instead of 10. After randomization, the groups were proportionate on age and sex. Race, ethnicity, and parent education were not substantially different between the groups. And parents were asked to report interventions that their child was currently receiving and had received from birth until the start of the study. For procedures, a randomized delayed treatment control group design was used to address the study aims. A recruitment letter was mailed to parents of children on the clinic waitlist for the gorilla group. Families were given 2 weeks to respond to the letter or a follow-up phone call before an email announcing study recruitment was sent to the clinic to fill the remaining spots. Parents were screened by phone to determine if them and their children met minimum study inclusion criteria before being invited for an assessment. So continuing with procedures, assessments took place at pre and post intervention and 2 follow-up visits, 3 and 6 months post intervention. At each 60 to 90 minute assessment, parent and child intervention strategy knowledge was tested, and a 15-minute parent-child play interaction assessing application of strategies was completed. So the gorilla groups met for 90 minutes weekly, and the sessions consisted of parent-child, large and small group activities targeting social communication and self-regulation. So parent sessions also met weekly for 20 to 30 minute sessions. The parent sessions consisted of review of the previous week's homework, as well as discussion of the current week's concept and brainstorming how to practice at home, group behavior problem solving for one family, discussion of what the children are doing and how to support them in the upcoming parent-child activity, and also assignment of homework for the week. Fidelity was monitored with video recordings of each session. Adherence checklists were monitored by the principal investigator, and deviations were discussed with the clinical team at weekly meetings. Next, we have our instrumentation and measures. So, the first one is the Child Observation Protocol, or the COP. This is a 22-item structured measure of the 12 social communication and self-regulation concepts and vocabulary taught in the vocabulary group. Items were scored on a scale of 0 to 3, and they were also divided into 3 subscales, which were social thinking, self-regulation, and social communication. This child observation protocol was developed by the Gorilla Group clinicians to assess Gorilla Group concept and vocabulary knowledge. So this was administered during all assessment time points. Next, we have the parent report of group outcomes, the PROGO, and this includes 12 multiple choice questions testing general ASD knowledge as well as concepts and vocabulary from Gorilla Group sessions. This also includes 3 open-ended potential scenarios. So these 3 open-ended potential scenarios, parents are asked to describe the strategies they would use with their child in that scenario. Also, all parents completed this measure during all assessment points. Next, we have the analysis. So all analyses were conducted using the JMP13 Pro. Time times group interactions on the COP were tested using repeated measures analysis of variance, or another word for this is ANOVA. Repeated measures ANOVA were also used to test for time times group interactions on the multiple choice section of PROGO. Frequency counts of the number of Gorilla Group strategies and concepts recorded in the 3 applied scenarios from the PROGO were again analyzed using repeated measures ANOVA to test for time times group interactions for each scenario. And data from the 3-box task at time 3 and 4 were not analyzed due to the lack of effects between time 1 and 2. Moving forward, we have the results. This is a table included from the study which show all of the results. And some significant results are the auditory press during the 3-box task did not show any time times group interaction effects. So the auditory task is down below. And yes, then also significant time by group effects were found for the total COP score, indicating that the intervention group improved their self-regulation and social communication knowledge and skills during the intervention period significantly more than the delayed treatment group. Also, a significant time by effect was found for the total score on the PROGO, favoring the intervention group as well. And as you can see, this table is a great visual way to fully see all the results in a very concise way. It makes it easy to read by looking at this chart. And next, we have the discussion. So in conclusion, the results display that the Gorilla Group intervention is effective in teaching social communication and self-regulation concept knowledge to children with ASD and their parents. The parents and children both exhibited an increase in social communication and self-regulation concept knowledge after participating in the Gorilla Group as compared to a delayed treatment control group. Overall, parents stated that they enjoyed the groups, found the content to be effective, and appreciated the opportunity to learn with other parents of children with ASD. So based on these reports, this was found to be a socially valid blended intervention package for teaching social communication and self-regulation skills to children with ASD. So now for our critique, strengths. I found a strength of the study to be the fidelity data showed that the Gorilla Group was feasible for clinicians to apply each week at a high level of quality and behavior management. This is a strength because it displays strong external validity in the way that these results could be extended to a multitude of settings. So it's practical and definitely can extend beyond this study. Additionally, it represented a real-world community sample and included racial and ethnic diversity and 4 females with ASD. So for my critique of weaknesses, I believe a major weakness to the study was the small sample size. This limitation could have affected the outcome of the study and made the results less generalizable. It also did not allow for comparison of racial, ethnic, or sex differences in the treatment outcome due to the small sample size. Additionally, I felt that the scenarios were not very concise, leading to it not always being very clear. There was a lot going on in the study, making it difficult for the reader to follow along sometimes. So thank you for listening, and I hope this slideshow was enjoyable.